It can be quite a challenging and lonely place to continue to ask questions about the current COVID narrative because for most people, either they just want it to be over and so they don't want to hear more about it, or from the political and some parts of the scientific community, they don't really want to go back to the questions. And so you have this very strange place of silence where there are only a few voices asking questions. I'm one of them, and another one is Dr. Clare Craig. And I'll be sharing a video where she was making reference to this study, vascular and inflammatory diseases after COVID 19 infection and vaccination in children. And this was a large study. And the essence of this study, as you roll down, is that they essentially found that the risk following vaccination for myocarditis is substantially lower than the risk following infection. And this has very important implications when you think going forward for public health strategy. So that really got her upset, and she did a letter to the editor. It is something that's good to do, but it does take a lot of time. And in this here, she was talking about the actual speed of science, letter of concern to the editor of the Lancet. And she was talking about this paper that was published, and she thinks that the data was misinterpreted. So, what I'll be doing is sharing what she was saying. I'll jump in from time to time to give you some of my thoughts on top of what she's saying. But as I said, these are important questions because they have relevance to the longer term implications. You have to realize that if we don't get the science right with regards to COVID 19, there's a very strong chance that similar mistakes will be made again in the context of some other virus that will suddenly appear. And you have to keep pushing these points because if you don't, they will come back to haunt you. So let's take a listen to what she was saying at this time. This was recorded, I think, 2 months ago when she did the letter, but she has just recently published it in the past few days.
Hello, I am Dr. Clare Craig, and I'm making a video about that Lancet paper that has hit the press in the last few days. It's fascinating that these stories still managed to get into the press when apparently COVID's yesterday's news, but there it is. Now, there's all sorts wrong with this paper. So I'm going to start with the basics. We could do with a paper, and we could have done with a paper for years now, that has shown in an infection, if you've been vaccinated, is the risk higher from myocarditis? Now, there's a lot of reasons to think that it is from the data that has been released, albeit hidden in the appendix of many papers, and also from the overall evidence of what's happened in the NHS. So
I'm just pausing you here a moment to just emphasize this critical point. Part of what we should have wanted to know, but it was, as I describe it, inconvenient science, is that we know that there is an association between myocarditis and COVID infection. Okay. And this was shown best with a Big Ten study with college students. And they found that they did very detailed investigations looking at echocardiograms, MRIs, troponins, and they found that a proportion of them had subclinical myocarditis. Now, they then brought vaccines in. And this was one of the reasons why they were pushing for vaccination in younger people. They said, well, we'll protect them from myocarditis. But then, as fate would have it, the vaccine caused myocarditis. So there was that problem. But they got around it by stating that although the vaccine caused myocarditis, it caused less myocarditis than the infection. Well, here's the problem. The vaccine didn't prevent transmission. So if you had a risk of myocarditis with the vaccine, you would then get an infection and have a risk of myocarditis with the infection. So the real question should have been in those children who were vaccinated, Was the myocarditis with infection that subsequently occurred cumulative damage to the heart rather than just the one hit with regards to an infection? Because remember, if you had an infection and you developed a natural immunity, it's not easy for the virus to penetrate your mucosal barrier. And so, therefore, the risk of myocarditis on subsequent episodes, unless you had some other problem, immune suppression, or you had interferon autoantibodies, that risk would drop down significantly. Well, let's keep on listening to what she had to say.
In 2020, there was no signal in children for myocarditis and pericarditis. It rose in 2021 in the older age groups. It rose in 2022 in the younger age groups when they had authorization for them to get vaccinated. And it's still rising. So if you've got a situation where a problem is still getting worse, why are researchers publishing on what happened in 2020 to 2022? Why have they ignored 2023 since? It's 2025 now. They should not be ignoring what's happened since.
I'm pausing there again because this is a very important point. A lot of people are talking about, look at the peer-reviewed research. This is what it shows. But it's old research. It's not current in terms of what is happening. So you will still hear people talking about the unvaccinated dying in COVID. And you realize that they're talking about 2021 when you had the Delta wave, not with Omicron, the unvaccinated, or not in 2025. And so when the data does not keep up with the transitions in what is happening, you are left with incomplete data. And this is part of the problem that has been occurring.
And it's getting worse. So that gives you a little taste of what they were doing. There's three fundamental points to make about this. The first is these vaccines did not stop infection. So there is no reason to compare any risk between the disease and the vaccine because children who are vaccinated were exposed to both. So they had more risk than children who weren't vaccinated. So it's a completely nonsensical comparison to be making at all. What you do want to know is what the risk was after they were vaccinated, and nobody ever publishes that because it's not pretty. The second thing is that they looked in the medical records. So the whole study is based on the data where a code has been put into the medical records for a child. And we know from studies, again, years ago now, that teenage boys, when they had their booster jabs, 3% of them had a rise in the blood of a cardiac enzyme called troponin, which showed dead heart cells. But a third of them had symptoms. So to look at the tip of the iceberg at this stage is just denying the problem. Third of all,
pause there a minute, because she's making an important point. And this is something that I had raised all the way from 2022 when we were having the rollout, is that the focus had been on admitted cases with myocarditis. Now, you have to understand, myocarditis and, say, pericarditis, where the heart and the lining of the heart are inflamed, can cause symptoms, chest pain symptoms, shortness of breath. But one of the patterns that was very clearly occurring is subclinical myocarditis. And this is very similar to what happened with infection, where there was inflammation, but the inflammation was not connected necessarily with overt symptoms. So people ignored the symptoms, didn't realize the connection. And in the same way, whatever numbers they were having with children admitted with myocarditis, you have to understand that there is going to be a much bigger subset who had subclinical myocarditis, may have ignored the symptoms or not made reference to the symptoms. And as a result, you have a bigger cohort who have had damage to their heart that is unknown. These are parts of the problem that we're having to face.
Myocarditis and pericarditis are not the only adverse event from these vaccines. So to compare one rare problem is nonsensical. You need to look at all of the problems together and show what the real harm was. And it's 2025 now, so why are they still looking only at this one rare problem? Third, what I did is I dug out a paper from 2022, which is published by a group in Oxford. It was also looking at the same data set, albeit a subset of that data set. And in that paper, they showed clearly that in unvaccinated children, the risk after an infection of myocarditis or pericarditis was 4 per million. Now, that's a figure that I am not sure I believe, because they included children who were diagnosed as test positive in early 2020. And the only children that were being tested at that point, when the tests were relatively precious, were children who were already in hospital. So you've got a massive bias. So the fact that these researchers always include that period is a red flag. There is no reason to include that period. You should include the period when actually there was tons of testing going on. It was slightly ridiculous. But we've got plenty of time where you can make a valid comparison when the tests were, actually being done. But they always include the period when they weren't being done, because it biases it towards sick children. The second thing is, we have data from the NHS of how many children have been hospitalised with myocarditis and pericarditis each year. Now, it's not a January to December year, they use a financial year. But if you go from April of 2020 through to March of 2023, you get most of the period that they're talking about. And, in any rate, it's a longer period, so more of the risk. There were 371 children who were hospitalised in that period. Now, this paper doesn't talk about children, it talks about events, but it's the same data that they've got. And why would you want to count the same child twice? They talk about 650 events after an infection.
So what you can see here is that I think one of the sad things that I've realized is that it is so easy to manipulate statistics if you know what you're doing. And because most of the population is not well versed in statistical measures, and I can't say that I'm a huge expert, you then realize how easy it is to position things in a way that makes it sound perfect. So say, for instance, when we heard about safe and effective, 95% effective, they were talking about relative risk reduction, not absolute risk reduction. The population didn't know the difference. They thought that if 100 people were vaccinated, 95% or 95 of them wouldn't get the infection, 5% would. And this is the reason why they went along with the mandates, because that made perfect sense. But that was not what the research was saying. And it was a statistical trick. And so in the same way, we have these issues where statistics can make you show what you want to see, not necessarily what is actually truth.
So that doesn't compute. There were 371 in hospital, not 650. They said they've included deaths in there, but there weren't very many deaths. So that's very questionable in my view. They, of course, did modelling and massive adjustments to get the data that they had in their results, because these types of papers always do. But when you do huge adjustments, you end up with nonsense answers. And the nonsense answers they had was that they said that there was no sex difference in the risk after a vaccine, which every other paper shows that there is. The males were at more risk of being hospitalised. And they also crazily showed that the risk in the 5 to 11-year-olds was twice as high as the 12 to 17-year-olds. No other paper shows that. It's the opposite. So they have adjusted it so much that they've created these complete nonsense results.
I'll pause here because I remember when one of the papers came out showing that COVID-19 protects against thrombotic complications, which made absolutely no sense. But when you looked carefully at the data, it showed that there was this significant protection within the first week of someone being vaccinated. And you think that is just not feasible. It's not possible. So it is a statistical error that you have to know that you are going to try and take those things out in order to get an accurate representation. And so it shows you the challenge that we have in front of us. We are now 6 years into the pandemic, and people are still just as confused as to what worked, what didn't work, was it correct? I don't know if we'll ever get to any truth in this situation But the reality is that people are at least aware that they need to ask better and more questions.
They also chose to compare the infections in the 0 to 18-year-olds with the vaccinations in the 5 to 18-year-olds. Now, 0 to 4-year-olds are the sickest children. They're most likely to be hospitalized for any condition. So why would they include those children? Why would you do that? Why would you just not compare like for like over the same time period? It makes no sense. They also didn't include people in their 20s. Now, they were the ones at highest risk. So if you've got data on teenagers and you want to properly measure the problem, you include people in their 20s who had more of a problem and had Moderna, which was more of a problem. But what they did is they took the people in their teens and they diluted it with the primary school children who had less of a problem because they had a third of the dosage of this drug. The point is, there is a paper that we are still owed showing what the risk after infection is in the vaccinated compared with the unvaccinated.
Pause there. She is absolutely right. Now, I mean, at this point, I guess you would question, is it going to change anything? Because truthfully, the people who are unvaccinated at this point are unlikely to go and take a COVID vaccine. They're not even being encouraged by public health. The people who are being encouraged by public health are people who are already vaccinated, which in theory is counterintuitive. You should be more worried about the unvaccinated. But no, they're worried about the vaccinated because they are seeing the outcomes. So they are not saying why they are encouraging them, because there is a difference in the immune response and the outcomes. We are in one of the strangest times of science. And it's difficult because by me and people like Claire asking these questions, it raises concerns about the integrity of the of science, of medicine, and so on. And the thinking is, don't wash your dirty laundry in public. But I am very strongly of the view that if there is no proper public openness and transparency, we will do longer term damage to the whole health industry. And we are seeing this happen. We're seeing it play out in real life, because as I reflect on what has happened with RFK had always been fringe in terms of his views on vaccines generally. And we have a position now where he is in one of the most senior positions to make decisions about this. And this has largely occurred because the errors were so significant in the eyes of the public that they thought almost any change is better than nothing. Now, I'm not against RFK. I don't necessarily agree with everything that he says. I think that raising questions about vaccines generally and looking at ways to optimize the efficiency and to reduce risks is always good. But what has been done in this pandemic is a complete destruction of the trust in any vaccines that had been used for years. They're now trying to defend these vaccines that everybody had used because they will not openly state that COVID vaccines were not in the same category. You cannot compare the outcomes with regards to COVID vaccines to what measles vaccines, mumps, rubella, these are sterilizing vaccines, largely preventing infection. This was not the case with regards to COVID vaccines. They were designed to reduce the risk of severe disease in people who were at high risk and those who were at high risk and not previously infected. That's how tightly they should have zoned in on who was vaccinated. And when we look at the history and when we come back to this in 30 years, when they write the books on the pandemic period, and the historians and your grandchildren will ask you, what in the world was going on? What were you thinking? I mean, isn't it obvious that this would have happened or that would have happened? That's going to be the conversation in years to come. And as I said, I appreciate those people who continue to ask questions, Dr. Clare Craig being one of them. I continue to push that narrative as well because I do believe it is important. The final point I will say, there's a reason why I continue to talk. Some people think it's just about the fact that I want people who made mistakes in the past to be punished or something. No, no, no. I have no interest in that. I am happy for people to make mistakes and we move on and we learn from it. But here's the problem. COVID has not disappeared. The implications of COVID have not disappeared, no matter how much people will pretend it's disappeared. So based on that, what we are facing is the worst situation that could have happened. Highly vaccine-primed populations, ongoing circulation of this virus, triggering underlying myocarditis, inflammatory conditions in the brain, in the kidneys. Based on this, and based on the scientific extrapolation from this, we have to see excess mortality going off the scale over the next few years. I cannot see how that is not going to happen. And all we are trying to do now is raise awareness in the hope that if the clinical community, more so than the scientific community, gets their head around this, there may be a chance that we can mitigate some of the damage that has already been done. I can only hope. But the reality is that we are where we are now. And the truth is, the least of our worries is who did what was wrong. The big worry now is that you still have this virus quietly circulating, causing all kinds of strange complications in people. And then in the long run, it is going to hit not just morbidity, so more people will get sick, but also mortality. More people will die. That is the inevitable outcome if nothing is done. Have a good evening. I'll continue to keep you updated on the science.
A hero, an immune adventure. Humming Heroes, your lyrical guide to the body's defenders. Now on Amazon. Check the links below.